Hello. Thank you for viewing my presentation over electronic healthcare records. My name is Jamie Schatz, and this is for my course of NU 547 Healthcare Informatics at St. Mary of the Woods College, and my instructor is Dr. Jessica Myers. The main objectives I will be covering in this presentation are to identify what electronic healthcare records are, the history of electronic healthcare records, use of electronic healthcare records in advanced practice, benefits of electronic healthcare records, concerns of electronic healthcare records, key points, and also a few review questions at the end. Electronic healthcare records contain private information relevant to the patient, which include their date of birth, social security number, address, phone number, their emergency contact information, their past medical history, diagnoses, medications they take, their blood type, lab results, and diagnostic imaging, all located in one place. The history of electronic healthcare records were first used in the 1960s at Mayo Clinic in Rochester, Minnesota. Paper charting or documentation was used prior to that and has adapted to digital, which has changed how providers communicate and chart. All information is now digital and located in one place within a patient's electronic healthcare record. Electronic healthcare record in advanced practice allows providers to access a patient's healthcare record prior to a visit. It also allows all patient information in one place that makes ease of access to better treat your patients when you get more time to focus on your patient's needs. And it also allows ease for sending referrals with patient information. Many patients need to be referred to a specialist, and the electronic healthcare records make a transfer of information easy and quick. There are many benefits to the use of electronic healthcare records. First is the ease of access. Second, all patient information is located in one place. Third, secure communication. This allows the providers to communicate back and forth with each other over secure lines. And also this allows for secure communication between the patient and the provider using a health portal where patients can log in with their username and password, send a message to their doctor of their request of either an appointment or a medication refill or what the case might be, and the provider can reply back to let the patient know the answer to their question. Fourth, the electronic healthcare records are very time efficient. Employees are not taking nowhere near as much time to document or take down patient information. They simply type it in, save it, and all the information is there for the next visit or for the next provider to view. And then fifth, the benefit of electronic healthcare records is increasing productivity. With being time efficient and taking patient information, this increases the productivity of employees to better help take care of their patients. There are concerns of electronic healthcare records. Many fear of distraction by the computer to the providers. They feel that the computer is a distraction to not pay attention to the patient and their needs and concerns. I do feel that this can be eliminated if the computer is placed in a proper placed in the room to where the provider's back is not to the patient, and the screen does not obscure the patient's eye contact with the provider. Also, fear of security of patient information. Facilities would need to have a secure firewall system in place to prevent hackers of stealing patient private information. That would also be a violation of HIPAA if information is released. And then also another concern of electronic healthcare records is the system shutdown or loss of power. If the system shuts down or loss of power, you would have to revert back to paper charting, and then once the system is back up and running, all that paper charting would then have to be put back into the patient's chart. Also, with the access of the portals with the electronic healthcare records, many share that they have a sensitivity to providers' clinical notes about their interactions. And patients accessing their medical records might not necessarily be fluent in medical terminology or abbreviations, resulting in the patient becoming confused or offended easily out of misunderstanding when SOB stands for shortness of breath. The main key points of the electronic healthcare records are patients' charting is all done in one location, opposed to being done in separate doctor's offices and having to fax information and add to each other's paper chart. With the electronic healthcare record, patients' charts are all in one location. They are ease of access, and it is very time efficient accessing the patient's charts and being able to care for your patients. 3 review questions that I came up with throughout my presentation are just simply the first one: where was the first electronic healthcare records used? Number 2, list the benefits of the electronic healthcare records. And number 3, what are the 3 key points identified of electronic healthcare record use? Thank you again for viewing my presentation. This is a list of all the references I used to compile the information that I have presented. And if you have any questions, please feel free to reach out to me. Thank you.